All right, well, if you don't smile because of bad teeth or dentures, we've found help for you. Our own Tammy Hernandez catches up with a local dentist who's in the business of making people smile every day.
I'm at Sleep Dentistry Defined with Dr. Heath Lampee, and you really do make people smile every day, and we're here to talk about a success story.
Oh, yes. This is my patient, Winnie. Winnie came in about 6 months ago, and she had been wearing dentures since about 1969, regular dentures with plastic on the roof of the mouth. You just kind of put them in there. They can get loose. Sometimes you can worry about them falling out. So she came in and was looking for some options because she'd seen me on AM Northwest talk about implant dentures.
Yes.
And so she came in for her first appointment, kind of saw the condition her mouth was in. She was lacking some bones, so we had to figure out exactly where the implants were going to go, but we had just enough room to get them in. And so we had a couple pre-op appointments. At the first appointment, we like to take a CAT scan, which is a 3D x-ray of the mouth. That CAT scan gets sent to a computer where we can actually plan the implants in a software, and we can see how dense the bone is and how soft the bone is and how much bone is there. We can do the surgery on the computer before we do it in real life. And then we had our big surgery day where we actually worked with an anesthesiologist because it was a very, tough, complex case. And in one day, we did 4 implants on the top. We took out the rest of her bad bottom teeth, put 4 implants on the bottom, and then gave her new teeth that day.
So Winnie, it sounds like you've been transformed. You're a new and improved mouth, but what made you call Dr. Lampee in the first place?
I had gone to another dentist who didn't seem interested in helping me, and after watching Dr. Lampee on AM Northwest, I thought, he just sounded like someone who wanted to help. Dr. Lampee and all of his staff, they're just wonderful. They know that you're nervous. I had many bad dental experiences growing up, and that's how I ended up with the mouth that I had. They put me at ease and talked me through every step of what would happen.
That's so good. You're so good about explaining things too, I think.
Because I know how nervous and scared people are, and we have men, and I reserve an hour just to talk with my patients, like just to meet them, to say, this is who we are. We're excited to help you. How can we help you?
Right.
And so it was nice to meet Winnie, who she really wanted, to better her mouth, and we were able to help her. And so we did our surgery, and then we had a couple post-op checks after that to make sure the implants are healing great. And then at month 4, when all the implants are fused to the bone and everything is good and solid in there, we actually connected the implants to the teeth. And so now the implants, after 4 months, are anchored in there. And so she has such confidence when she goes out to restaurants or anything like that, and just that feeling that your teeth are strong, you're able to eat whatever you want now, basically.
Yeah,
right?
Anything. I'm not concerned about.
Like, I'm eyeing those candy bars.
The candy bars behind
Eat
us.
those?
Yes, well, on occasion.
So you can eat apples, you can eat anything that's hard or crunchy, and before you weren't eating things
I wasn't.
like that?
No, and it's like even eating popcorn at a sporting event was a struggle before, and now I don't have any concerns.
You don't even think about things like that when you don't have issues like that in your mouth,
And
right?
so I understand that, because this is a lot of what we focus on. I have a lot of my patients who have these issues where they can't go out to the movies, they can't go out to sporting events or restaurants because they don't have the confidence, and so we're able to change all that. That's what makes me feel really good and really excited about what we do.
Right, so you're making people smile every day. And I think it's interesting to point out that this didn't happen overnight. The procedure happened in a day, but then you have the follow-up, you have the pre-appointments, so if people are interested...
I want to show people what it really takes to do this and do it right.
Right, so people need to plan for that, is where I'm
Absolutely.
going with this.
Yeah.
Okay, good. Well, Winnie, I'm so happy for you. Thank you for telling your story. Dr. Lampee, thank you for all the great work you do.
Thank you so much.
And if you're interested in implant dentures, the number for Dr. Lampee is on your screen right now. Give him a call at Sleep Dentistry Defined. Back to you.